To respond to my opponent's claims, it is not true that universal health care will be more expensive because it'll actually be cheaper. It will be more efficient because think about all the times when we have to go to the doctor. Paperwork that needs to be filled out over and over again, insurance paperwork that needs to be submitted every single time, claim must be submitted, and then approval department would have to go over the claim. Checks will have to be mailed, patient needs to send bills, and etc. If there was universal health care, it would build one centralized system to those would save billions of dollars every year. And to also respond to my opponent's claims, it will actually be more equal because universal health care will give everyone the same access to insurance, not more to some people than others. A centralized system would allow treatment and diagnosis easier for doctors as well, because every time a patient is at a hospital, they might lie or do a poor job of explaining past medical problems. Doctors need accurate information to make proper diagnosis. A centralized national system will lead us to medical advances and increased diagnosis efficiency. Some may think that certain insurance providers may deny coverage if they find certain past medical problems, but if the government was paying for everything, it will not be a problem. A successful example of a country with universal health care would be Brazil. According to a Center for Strategic and International Studies report, free healthcare coverage is recognized as a citizen's right in Brazil. They both have a private and public health system, and about 80% of Brazil's population relies on public care, while the wealthiest 20% can afford private health care. Since the 1990s, Brazil had also provided universal access to HIV and AIDS tests. According to a 2011 article in the medical journal called The Lancet, during the last 3 decades since the nation's major health changes, infant mortality decreased and life expectancy increased by 10.6 years. In conclusion, I believe that every person should be covered with health insurance because a person does not deserve to die just because they cannot afford the costs of health care. The government should require the access to health care and medicine to be keeping somebody alive and not just leave them to die. Healthcare today is way too expensive for businesses and individuals who wants to pursue their dreams by taking risks and giving more to the economy but does not have the opportunity to because they are being held back by health insurance expenses. They can give more back to the economy if they have more money to go towards raises, new hires, investments, like what I said before, instead of going towards health insurance. Healthcare today also causes medical bankruptcies because of the high prices. However, if there was universal health care, we can stop bankruptcies and save millions of people from losing their homes. The right to health care should be considered a civil right. People should not be discriminated against for being sick. Americans who are ill should not have to make the choice between financial ruin or paying for the medical treatments they need to stay alive. Like what I said before, even the Declaration of Independence states that a person should have the right to live and we are all created equally, which means that we should all have equal opportunity, not to those who can afford it. This is why I believe that the federal government should provide universal health care to all Americans.